Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about how to manage Invisalign cases with existing implants. That means they already have an implant, now they're asking for Invisalign. That's a little bit backwards on how we want things. Ideally, we want to do the aligners first and then put the implant in. But sometimes things happen backwards, right? Patient comes to you, it's a new patient, they're like, hey doc, I want to get my teeth straightened, but they already have an implant. So I already have a different video on how to prep cases if you want to place an implant. And if you want to learn more about that, you can go into my channel, which is the YouTube channel, StraightSmile Solutions, not YouTube in general, but my channel, StraightSmile Solutions. And within my channel, you go to the little magnifying glass, and which is a search. You can put in the keyword implant, and it should come up, or implant, Invisalign. But today we're talking about the backwards version. So the question is, can we do it? Should we do it? Do we want to do it? And that's a case-specific answer. Every case is unique, and it really depends on the complexity of the case. Obviously, if you have an implant, we can't move that tooth, nor it's not only that sounds simple, right? But it's more complex than that, because let's talk about, again, I like to refresh your memory, how do we address crowding, right? Well, the way we address crowding is one of 4 to 5 different ways. Number one, we expand arches simultaneously, top and bottom arches. You can't just really expand one without expanding the other. You can get many millimeters per arch by expanding arches. Well, we can't do that if we have an implant, so that way's out the door. What else can we do? We can procline incisors. Sometimes that's possible, sometimes it's not. I'm guessing if this patient has an implant, they're probably on the older, side, 30s, 40s, 50s, 60s, 70s. They're probably not 10 or 15 because we don't place implants in teens because the bone and the ridges are still growing. So a lot of times we can't procline in an older patient anyways because of perio, because of bone loss. So that's usually off the door too. So we're running out of ideas. Distalization is another way that we can get space in crowding patients. That means scooting the teeth one tooth at a time sequentially in order backwards, assuming there's no impacted or erupted third molars, assuming we have space in the ridge to make space. That's out the door if we have posterior implants. So like I said, there's a lot of limitations. Once you get that one implant placed, whether it's just the implant itself in the bone and it's not restored yet with the crown, or if it has the crown, you are limiting things. What else is limited? Well, a lot of times if we have a deep bite, we want to level out the arches. Well, in order to level out the arches, we do ortho. Sometimes we place anterior bite turbos. Well, we can't do that if you have an implant, especially a posterior implant, because we have to do it of all the teeth, and we can't move that one tooth, so we can't move any of those teeth. So it really, people don't think it limits things, but it really limits things on what we can do. It limits the amount of puzzle pieces, limits the amount of chess pieces in the game. Like, it's literally strikes out half of our options. So sometimes we can get some improvement, but we probably can't get perfect. Sometimes it's really not worth it, in my opinion. Okay, it's like, okay, we're only going to be able to improve 30%. Is it really worth it? Why not just do this with restorations instead, like crowns or veneers or something like that, if that's what they're looking for. So sometimes if it's just like a front tooth issue, like a little bit of a crooked incisor or a little gap between 8 and 9, and they have a posterior implant, sure, that's fine. We can do that, okay? It's just a limited ortho treatment. We're not moving back teeth, we're only moving front teeth. That would work. But if it already had an anterior implant, and they're looking for changes, it's probably a no-go. Better to just use restorative in order to get improvements cosmetically. Hopefully that was helpful. And just a friendly reminder, anytime you're gonna place an implant in a patient, please ask them if they'd like to be considered for an orthodontic consult. Don't just do the consult anyways, because so many times I'm working with doctors that maybe a patient has moved from one doctor to another and they're really upset. They didn't even know that was an option, and they got the implant. They felt pushed and rushed into the implant, and now they lost the opportunity to get the ortho that they needed. So make sure you mention it. All right, thanks so much.